sadness, isolation, anxiety, loneliness. These are all symptoms of a very serious yet very silent killer inside the world of the enigma, the anathema that is clinical depression. A very special In the Know with Phil Hayes starts right now. Depression in one form or another affects all of us, either individually or collectively. Each of us knows someone that, like I did in my cancer show, either is affected by it or knows someone who is. In this show, we hope to shine the light on not only depression, but some of the fragments of it, such as bipolar disorder and post-traumatic stress disorder, the latter of which is responsible for a large number of uptick and suicides among our military who have been serving in Iraq and Afghanistan. In this episode, we hope to kind of parlay some of our information to you, the viewers, so that you may help get the word out about depression and maybe help people who are affected by it in your own right. So, let's get started. And we're here with Helaine Betnun. She's a licensed clinical social worker here in Annapolis, Maryland. Helaine, how are you?
I'm fine, Phil. Thank you.
Thank you. Thank you for being on our show.
Well, thank you for inviting me. This is very exciting.
You're welcome. You're welcome. Tell us a little bit about your practice and how you got started in counseling.
Okay. I guess I'm a child of the 50s and 60s, and I remember, like in high school, my mother said I could be one of three things. I could either be a teacher, a nurse, or a social worker, and the latter sounded like the most promising career. Some people, women in my era, did go on to become lawyers, but I'm very happy that I chose social work as my profession. It's been very rewarding.
Really? So how, it's interesting that you mention that, because a lot of people talk about how they look for the good things. When you do what you love, it's not work.
No.
It's a joy.
Yes.
What have been some of the rewarding experiences besides helping people that you've encountered in your job?
Well, just each day is different. I find each day fascinating. I'm never bored, and I really so enjoy relating to the people who come to see me. It's intrinsically rewarding.
Explain to us what depression is, as far as from a clinical standpoint, varying stages of it. What are some of the modalities by which the symptoms of whatnot, how people, become depressed, if you will?
Well, it's a pretty broad and complicated diagnosis. I kind of think of it more of a range, that you can go from very mild to very severe. From a lot of people, I think, have seasonal affective disorder. They become more, let's say, feel like they have the blues. When there's no sunshine and the days are shorter, sort of lack of sunshine, to going to being a major clinical depression where people can be suicidal and where they're just so despondent and lack hope that they want to end their lives. So there's just a wide range of symptoms for depression. and I deal kind of more with, probably closer to the more severe depression, people who have suicidal ideation. Some have made suicidal attempts, been hospitalized. But I also see people, sometimes just with a seasonal affective disorder, or also one of my clients was just diagnosed as dysthymia, which is a very mild but chronic depression that lasts more than a month. It can actually be throughout her life, so that she can handle most things, but then all of a sudden she'll just be overwhelmed with sadness.
In my research, I read that there are various levels, various stages of depression. MDD, which you mentioned, and then of course there's bipolar
Yes.
disorder, and one that I actually found interesting, which is called I believe it's the seasonal disorder.
That's what I was talking about.
Yeah, where it's a seasonal attentive disorder. I
No,
think it is.
affective. That's what I was
Affect-
talking.
yeah.
That's what I was talking about before, the seasonal affective disorder.
Okay, okay.
Which is a lack of sunshine, and people tend to be more down in the winter months.
Okay.
And it's very important to be able to distinguish between, let's say, major depression and bipolar. Bipolar, the client will often present as depressed, but then they also have what they call manic episodes, which is maybe overspending, being maybe sexually promiscuous, the certain symptoms that go along with the manic. And if you misdiagnose it and just treat the depressed symptoms, then they'll go over into the mania. So there's certain, what they call mood stabilizers, that will help a person with bipolar. So it's up to the psychiatrist to make those determinations, what kind of medication to use for which patient.
Right. Can you, for our viewers who are watching, explain? I mean, I know you just did, like a kind of a soft soap of all of those different. What are some of the more in-depth, more detailed symptoms
Okay.
of
Depression.
depression? Primarily the seasonal one. I know that that it's like they're there, they're fine, and then they're not. But with bipolar, and it's especially the more clinical side of depression, that seems to me like a kind of disorder that stays and is rather consistent. Can you kind of delineate between the various ones, just more in-depth symptoms?
Well, I guess if I see a client, if I'm trying to make a determination, I will ask what their what we call vegetative signs of depression might be. That would be appetite, either eating too much and not enough, sleep disorder, sleeping way too many hours, or not being able to sleep at all, inability to concentrate, so that they have problems of work, memory difficulties. So those are some of the symptoms that can affect how they live their day-to-day life. And it can go from, again, being able to function at, from the outsider would see them as being very strong and capable, but inside they may have some real turmoil that, that perhaps people won't see on the surface.
I've always been curious as to how it has become such a profound, such a fluent malady, if you will. Like, seemingly, well, maybe not with you because you're a counselor. You see this all the time, but as someone who is just a regular layperson who understands nothing about counseling or medicine or anything of that nature, behavioral patterns. It's been that bipolar disorder just seemingly popped up over the last 10 or 15 years. I'm just trying to get a better understanding of what it is that causes a person to 1 minute be on, and then maybe the next minute be not so on.
I personally think that bipolar has a biochemical component to it. When the person has no control over what the emotions are, I could see that even with children, that they'll be emotionally labeled, be up and down, they'll have these mood swings. So I think it's been around, they just didn't call it bipolar, but it's, I think you've always, known people who are very moody. From one moment to the next, you don't know how they're going to be reacting. And it's also, again, with bipolar, it can be a whole range of patterns. It can be from, having months and months of depression and maybe spike to a manic stage and then down into the depression over a period of time. Or I had one woman that I saw years ago who would be cycling. She told me after we were, finishing up our treatment, she says, I would be up and down at least 5 or 6 times during our sessions. I mean, I knew that she was bipolar. I didn't realize how she was cycling so quickly. And then I had referred her to a psychiatrist who was able to help her with medication, have a mood stabilizer that would make her capable of going out and getting a job. So, as I say, there's just so many different patterns to it.
I've been trying to film this show for a year, and it's been difficult because, from a research standpoint and from, being able to kind of see some things, I didn't feel that I was ready to film it. I wanted to make sure that I was somewhat learned about the subject before, I came to try to film it. With regards to treatment, we've talked about symptoms, we've talked about prognosis and whatnot. Treatment, the after effect after the prognosis. What, from a medicinal standpoint, have been,
I'm not a
and
doctor.
I take that back. I don't mean names per se of medicine, but I'm sure that's one side. What are some of the ways that depression can be treated?
Okay.
Medicine is obviously one.
Yeah. Well, certainly I would refer, if someone is chronically depressed or even mildly depressed, I might send them to a psychiatrist for an assessment and medication. They have the SSRIs and they have all kinds of mood stabilizers and things that can help them. But they find that with the medication and counseling is the best combination. Because I really do need a place to talk about who they are and what's going on inside of them. I was just going to say another. So I would say there's 2 different types of depression. One is sort of what's internal, what we used to call endemic depression, which we maybe now would call it biochemical. In which case, those react very well with medication, and that would certainly be maybe the best way to go. Other people have, they become depressed because of environmental issues, maybe the loss of a parent or a loved one. And so they're more in mourning or grieving. However, sometimes that can go on what we call prolonged grieving, in which case, again, the medication can be useful. When someone comes in, certainly the counseling, being able to talk to somebody, very often they have secrets inside of themselves, shame and guilt that they've probably never expressed to anyone else before. Perhaps they've had a traumatic experience such as rape or violence or just verbal abuse, things that just kind of eat away at your self-esteem, which can engender this kind of depression within them. So some of the things that I ask people to try to do is to, just live sort of what your mother would tell you. You should get plenty of exercise, to eat healthily, to maybe, if they could journal their moods and feelings so that we can get a handle on what's going on. I try to find a passion, a hobby, something that you can kind of give yourself over to help counteract this despair that you might be feeling. Sometimes at the beginning, I have been, in this field since 1969, and at the beginning they didn't have any really effective medications. They would use Valium and Elvil, which would make them so sleepy and non-responsive that you would do the counseling with them, but they were kind of in a fog. And I used to say to them, if only we had a magic pill, and that's what's so exciting now, is that you do have the SSRIs and the various newer medications, so that person can actually have, they say it's like having a cloud lifted from them. It's just like, I sort of picture it as the Claret and Clear commercials, where it's sort of foggy and then all of a sudden things are clear, and it can just give them enough energy to be able to work and to react and interrelate with other people. It's to me, it's a real miracle and the wonder of being a counselor in this day and age than when I was first working. I had an interest, so this past week, because you had asked me to do this, I spoke with many of my clients about how they saw their depression. And it was very interesting how they worded it. I have a couple of examples.
Sure.
There was a lot of like let me see if I can find similarities but differences. And well, actually, it made me think of the quote from Tolstoy where, let me see if I can find it here. Every happy family is the same, but here we go. All happy families resemble one another. Each unhappy family is unhappy in their own way, which I think sort of describes a lot of what we're talking about.
Mm-hmm.
But some of the symptoms that they described, and obviously, everything's confidential,
Yeah, exactly.
is that they feel, this is what you were talking about, just being tired, feeling that they couldn't do anything, they couldn't get out of bed. They have a sense of isolation. That's a big one. People are very lonely. They're lonely, but they don't have the energy to go out and meet people. So that's another thing that I encourage people to either go to a place of worship or maybe take a class or just be able to interrelate with other people is so important. Feeling exhausted, hopeless, again, lonely, unable to visualize a positive future. These are my clients who are edged towards suicidal ideation. And the gift of counseling is it gives them someone who they can relate to. Sometimes these people are so isolated, I might be their only person they see during the week. So I know when I go on vacation, I feel very, very guilty. And another expression is they feel like they're in a deep, deep hole, that it's like being in a black hole, unable to get out. There's no way out. Sense, again, self-isolation, frustration that maybe they have been successful and now they've lost their position for one reason or another, sometimes due to illness. Illness can also, like cancer. I have several clients with cancer or, in recovery, but, they're very vulnerable. And I also feel that depression and getting ill are intimately related. I know that was true with my mother. My mother was probably chronically depressed, and she, had cancer, and she really just gave up and died by the age of 55. But a lot of depression runs in my family, so I can really understand it, as well as I have seasonal affective disorder. So I can see it out that window if it's cloudy out, and just feel this just going down, just slightly blue. So you have to keep your spirits up. Again, trauma can also be a cause for depression. I have people who have been, again, either sexually molested or raped or whatever. Those kind of things. It's not just the time of the violence, but the fact that it stays with you for the rest of your life. There's just no time that that's not a part of who they are and their personality. And again, you were saying about children, the earlier something traumatic happens, the more severe and chronic those symptoms will be.
Right. And the reason that I brought up the children aspect, and I'll say this to you all personally, because on my Facebook page I mentioned why it is that I was interested in doing this show, not just because of the notion of trying to help counter depression from a clinical standpoint and how to treat it, but also because of the recent uptick of suicides among children who have been bullied.
Yes.
In high school and junior high, which I think is a shame personally.
It's just so tragic.
Yeah, it's becoming into an epidemic. There have been so many. The most, well, I won't say famous, but the most well, I guess you could say famous, is a young lady by the name of Amanda Todd, who actually, I believe she recorded a YouTube video with music in the background and cue cards explaining everything that had happened to her. And to see that, and to see a kid basically begging for help, and can't get it from, her community, from her parents or whoever. I know what I was doing when I was 15, 16 years old. And I'm sure that you know what you were doing and neither one of us probably can say that we were making videos where we were basically begging for help. Just from a general standpoint, just total opinion now, not professional.
Good.
What would be your mode of treatment or advice to children who are facing something like that in school and basically have nowhere to turn?
I know that now in school they do have outreach and different programs. I know that my Anne Arundel Women Giving Together Circle, where we contribute money and then we vote on, we have requests for proposals, gave a certain amount of money to the school system that has a program in place to teach people about bullying, the teachers and the other students, so that they know how to reach out to them. And I think that would work not only with the people who are being bullied, but also those who, act out violently, within the school. This is all, it just seems like the world is going faster and faster, it's more and more chaotic. I think being a child now is so difficult. I have a daughter who's very religious, and so she really protects her children so that they don't watch television, they're not exposed to these things. And sometimes I think she goes overboard, but in a way, they kind of live a very, what would you call it, a very secure. They feel secure and protected. And it would be nice if other families could do the same. I believe that watching things that are violent on television affects you very profoundly. Like, on 9/11. I watched it twice, but I didn't want to see it anymore because it becomes imprinted on in your mind and your brain. And I think that we, as a country, ended up with, I know that was your other subject, post-traumatic stress disorder, some greater than others, depending on, where we were. But I know for me, my granddaughter was born that day. She was born at the time that the planes were leaving Boston. She was born in Boston. So I had to go on the train to go visit her, because there was no way to go by airplane. And there was a young woman in front of me who was crying. And so I said to her, what's the matter, honey? I'm a social worker. And she said her best friend was one of the flight attendants on that, on the airline that went, I guess towards the Pentagon, and one of those. But someone had switched with her, and you wondered, did that other person know? I often wondered. But everybody has their own set of stories. So, from people who are right there at ground zero to all of us in the country, and it changed the way that we are and how secure we are and how, and all of this can also lead to people feeling helpless, because they feel maybe helpless and hopeless within, and then outside they don't feel protected.
Well, oddly enough, you mentioned 9/11 because the circumstances after that led to, obviously, the war in Iraq, the war in Afghanistan. A lot of troops went, a lot of troops came back. And, to tie in with the post-traumatic stress disorder, I personally have a good friend that she was glad that I'm doing this show because she's lost a couple of friends. They were all in the military, and she's lost a couple of friends to suicide because of post-traumatic stress disorder. I know that you don't really deal with the troops that much.
No, I don't.
Right, I understand. But again, just from general speak, as it relates to the post-traumatic effect after the trauma happens. And again, we'll just rely on your experience with the people that you have counseled.
Well, there's certain symptoms that can occur. One would be, again, lack of sleep because of the night terrors and the fear and hypervigilance. And again, it can come from someone who has, let's say, even if you just witness a car accident, in passing, that can affect you, particularly if you were in a car accident yourself. If you were traumatized as a child, it just stays with you, so that becomes so much a part of you. The post-traumatic stress disorder is related to anxiety, and fearfulness. And it was interesting because I did a little bit of reading about it, and they said that the antidepressant, SSRI medications work very well with those people, but not with the service people. Because theirs is probably so ingrained, because it would be that fearfulness day after day after day. You never know what's going to happen. And so that particularly people, these young men who go, one tour after the other, that even if they don't have a physical symptom, that I would think almost all of them would have some sort of emotional or psychological problems, and they become more isolated perhaps, and they don't reach out. And what's important is to, they have vet centers now that work very closely with these people, and there's some really good things on the internet, explaining how this will help you, and to reach out, to counseling probably within the military. And I noticed I said for counselors with my National Association of Social Workers, they have maybe 5 or 6 different programs for us to click on and learn about this, so that when we deal with the veterans, that we can be more effective.
They experience the same kind of PTSD that regular people do, but they experience it on perhaps a more intense level.
I would think so, yes. And maybe they're more, they're used to being in a group, and then all of a sudden they're out of the military, they don't have a job, they don't have any connections. Maybe if they had a significant other, maybe that relationship is no longer working because you've been away for so much time. So all those things can kind of come together. And these people are very young to go in, 18, 19, 20, So they don't have any resilience. I think that's one of the things that I try to work with people, is to have a sense of resiliency, of ability to overcome whatever circumstances have thrown at them.
Another type of depression that has intrigued me over the years, and that's because I read that Brooke Shields actually went through this several years ago, is postpartum depression.
Oh, okay,
And
yes.
that's, my at the risk of sounding sexist, no, I'm not, okay? Let me clear that up right now. What has been kind of intriguing for me is postpartum depression as it relates to whether it's an either or both and proposition. And I'll tell you what I mean. Is it postpartum depression from the sense of it being hormonal and something else? Or is it postpartum depression just for the mere fact that it may be something mental, or the fact that they're no longer carrying a child, as in just a singular type of option? Meaning, is it hormonal and or hormonal or?
I always like a both and proposition for almost everything. Yeah, I do believe it's hormonal, but also there's this lack of sleep. Your whole life, particularly if it's a first child, your whole life is turned upside down. All of a sudden you're responsible for this other being. And, again, if you've had depression before, this can intensify. And sometimes the depression just comes out at the time of the postpartum, and people don't realize it. I know I went through that experience not realizing what it was. I know I was feeling very drained and tired and depressed, but I don't even know if I knew the term then, postpartum depression. My children are in their mid-30s now, so it wasn't quite as current. But then later on when I studied postpartum, I said, that's what it was. Yeah.
Well, and again, another reason I asked is because, and I said I wanted to ask, I wasn't going to initially, I do want you all to know that, I wasn't going to because, again, I've seen different cases of postpartum depression, not not up close and personal, but again, just things that you read about with, like people like Brooke Shields. I just wanted to kind of, shine a little bit of a spotlight on that because, again, there are various forms of depression, but again, I wanted to kind of cover as many bases
Yes.
as I could. Mainly clinical depression, mainly the bullying aspect of depression, and obviously the PTSD aspect. But again, from a female standpoint, wanted to be able to bring up postpartum depression. Getting tongue-tied now. Postpartum depression.
Yeah. The other thing that I had observed early on in working particularly with women, it would seem like once a month they have these kind of episodes. And this was before we knew about, the menstrual PMS. And so I said, someday there's going to be female doctors that are going to be aware of that this is a real thing. And sure enough, that happened about that time. But, that's a time when because of hormones, women's moods can take a dip. And so and I'm not a sexist either. So so it's really important, to take into account all kinds of things. I also think that men and women express their depression sometimes in different ways. And again, stereotyping, and I apologize, but I think men sometimes one of their symptoms can be irritation, being cranky, being angry. That part of the depression will come out, whereas a woman becomes sad and crying and have more kind of what you would think of as depression. But they're both part of the same syndrome, I think.
For people who might be watching this episode on our channel and on our Facebook page, who think that they may have some of the symptoms that you've mentioned in this show, what would you recommend to them with regards to whether or not to pursue treatment, and if they do, how they should progress about it?
Well, certainly I strongly think that counseling is really helpful. If nothing else, just an assessment. And again, sometimes the depression can be seasonal, or it could be in reaction to a mourning or grieving. I think it helps to talk to someone else. We're losing our connections with one another. I think people enjoy coming to counseling because someone is totally listening to you for like 50 minutes or an hour, and that you can say whatever you want and not be judged. And I think that that's a real relief for people. That you're not going to be judged, and you can reveal your secrets, and it's confidential. And this counselor will help you try to figure out ways to make you feel better. Whether it's maybe suggesting yoga, going to the gym, writing, doing some art, go bike riding. There's all kinds of things that can lift your mood, and if necessary, if it's serious enough, maybe some medication. A lot of people don't want to take medication, so we certainly try other methods as well. Yeah, but there was help, definitely help.
I like that. Helaine Betnun, licensed clinical social worker, Annapolis, Maryland. Thank you.
Thank you
for giving us your time today. Thank you so much.
I appreciate
I can't wait to get this edited and get it up so people can watch it, and it's going to be wonderful. Thank you again so much.
Thank you.
We'll be right back with more In the Know in just a moment. Typically at this point of the show, whatever show I'm working on, I normally have some notes that I reference or a short script that I kind of follow to do my outro and my close, and then we round out the show. For a subject like this, I decided to just kind of go off script and just speak from the heart. Post-traumatic stress disorder, postpartum stress disorder, bipolar disorder, and just all around clinical depression are ails of our society that take the best and brightest of us without warning, without cause. Everything is symptomatic, and we often wonder why it is that we never recognize them until it's too late, of course. Between troops who are coming home from war, or teenagers who can't handle being bullied in high school anymore. Clinical depression is a major problem that must be dealt with. As I stated in the interview before, I've been trying to do this show for a little over a year now. Mercifully, Helaine Betnun was one of the few people who agreed to try to talk to me on camera about not only treating disorders like these and the maladies that cause them, but how to move forward as best and as successfully as possible with something like depression. I want to relay a story to you. There was a troop, actually two of them, who'd just come home from the war, I believe it was, from Iraq. One was a special forces troop, one was a regular troop from the Army. They went out to a gun range one day just to try to get away from it all and try to have a little bit of fun. One troop was affected with post-traumatic stress disorder. And at some point in time during that visit to the gun range, you may have read about it in the news, he turned the gun on his friend and shot him and killed him. This is not natural, and furthermore, it's unacceptable. It is my hope, and I hope the hope of others, that people like Helaine Betnun and other licensed clinical workers and counselors will help slowly begin to bring about the decline and eventual ultimate eradication of depression and these disorders that come with. I'm Phil Hayes, and you're in the know. We'll see you next time.